Ever wondered why some people struggle to breathe during certain seasons or in specific environments? Well, the answer to that riddle might lie in a common but often misunderstood condition called asthma. Asthma is a pervasive health issue that affects millions of people worldwide, from the young to the old, the athlete to the artist. Yet, despite its prevalence, many of us only have a vague understanding of what it is, how it affects the body, and how to manage it. Asthma is more than just an occasional wheeze or a bout of breathlessness. It's a chronic condition that inflames and narrows the airways, causing a range of symptoms that can range from mild discomfort to severe and life-threatening attacks. Imagine trying to breathe through a narrow straw while someone gently squeezes it tighter. That's what an asthma attack can feel like. The triggers for these attacks can be as diverse as the people they affect. For some, it's a cloud of pollen on a spring morning. For others, it could be the cold winter air or even the family pet. Understanding these triggers, recognizing the early warning signs, and knowing how to respond is crucial for anyone living with asthma. But why should we care about asthma if we don't have it ourselves? Well, even if you're not directly affected, chances are you know someone who is. Your friend, your colleague, your loved one, your child. Asthma doesn't discriminate, and neither should our understanding and empathy. Moreover, as health enthusiasts, it's our responsibility to educate ourselves about these health conditions, not just for our own benefit, but to support others in their health journeys as well. Over the next few episodes, we'll be delving deeper into the world of asthma, exploring everything from its causes to its impact, and most importantly, how to manage it naturally. So if you've ever gasped for breath or felt your chest tighten, you may be dealing with asthma. But don't worry, together we'll learn how to breathe easier. Stay tuned, the journey has just begun. Asthma is not just about wheezing or gasping for breath, it's a complex response of the body to certain triggers. It's a chronic condition that affects the respiratory system, specifically the bronchial tubes that carry air in and out of the lungs. Picture your airways as a series of tubes, transporting vital oxygen to your body and expelling carbon dioxide. In the case of asthma, these tubes become inflamed and narrow, making it difficult for air to pass through. Now, imagine trying to breathe through a tiny straw. That's what an asthma attack can feel like. It's a scary experience as you're fighting for every breath, your chest tightening with each gasp. This is often accompanied by wheezing, a high-pitched sound produced by the air squeezing through the constricted airways. But asthma isn't just a one-off occurrence. It's a persistent issue, with symptoms that can vary in intensity and frequency from person to person. Some may experience mild symptoms occasionally, while others might deal with severe symptoms daily. Regardless of severity, all asthma sufferers know the fear that comes with an impending attack, the dread of that next breath becoming a struggle. Asthma doesn't discriminate either. It can affect anyone at any age, regardless of their health status. Children, adults, athletes, or office workers, anyone can be at risk. It's a condition that spans across all walks of life, all around the globe. In fact, it's estimated that hundreds of millions of people worldwide are living with asthma. But it's not all doom and gloom. With the right information and management, asthma can be controlled, allowing those affected to lead healthy, active lives. Knowledge is power, and understanding the intricacies of this condition is the first step in taking control. In essence, asthma is a constant battle for breath, a struggle that millions face every day. But with awareness, understanding, and effective management, it's a battle that can be won. But how exactly does asthma work? What happens inside your body when an asthma attack strikes? Well, let's take a journey inside the human body to see how this all unfolds. Think of your airways as small tubes, similar to the branches of a tree. These tubes are lined with a thin layer of muscle and a delicate mucous membrane. In a healthy state, air moves freely in and out of these tubes, allowing us to breathe without any difficulty. But for someone with asthma, the story is a little different. When exposed to certain triggers, the body's immune system responds by causing inflammation and swelling in these airways. This inflammation narrows the passage for air, making it harder to breathe. Simultaneously, the muscles around the airways tense up, further constricting these tubes. This is known as bronchospasm. It's like a double whammy, with inflammation and bronchospasm working together to make breathing a real challenge. But that's not all. The inflamed airways also produce excess mucus, adding a third layer of difficulty to the process. It's akin to trying to breathe through a straw while someone is squeezing it. This triggers the symptoms we often associate with asthma: shortness of breath, wheezing, and chest tightness. The body, realizing it's not getting enough oxygen, responds by making you cough in an attempt to clear the airways and ease the breathing. So, to recap, an asthma attack typically involves three main components: inflammation, bronchospasm, and excess mucus production. All these together lead to the narrowing of airways and the classic symptoms of asthma. But not all is lost. With the right management strategies, it's possible to control these symptoms and lead a healthy, active life. And that's exactly what we'll be discussing in our upcoming segments. Understanding this mechanism is key to managing asthma and reducing its impact on your life. So, stick around as we continue our journey towards breathing easier. We've talked about what asthma is and how it works, but what sets it off? What are some common triggers? Asthma triggers are essentially anything that irritates the airways and sets off the symptoms. It's important to note that triggers can vary from person to person, and what affects one individual might not affect another. However, there are certain common triggers that seem to affect many people with asthma. First, let's talk about allergens. These are substances that cause an allergic reaction. For those with asthma, allergens can trigger an attack. Common allergens include dust mites, pet dander, pollen, and mold. You might find that your asthma symptoms flare up during certain times of the year, like spring when pollen counts are high. Environmental factors are another common trigger. This can include things like tobacco smoke, chemical fumes, and air pollution. Even changes in the weather, such as a drop in temperature or high humidity, can set off asthma symptoms. Certain health conditions can also trigger asthma. For example, people with sinusitis or rhinitis often find that their asthma symptoms worsen. Gastroesophageal reflux disease, also known as GERD, can also trigger asthma in some people. Physical activity is another common trigger, but don't let this discourage you from being active. Exercise is important for overall health, and there are ways to manage exercise-induced asthma to stay fit and healthy. Lastly, emotions can play a role in triggering asthma. Stress and strong emotions can lead to fast breathing and hyperventilation, which can trigger an asthma attack. Identifying your personal triggers is a key step in managing your asthma. This might involve keeping a diary of when your symptoms occur, noting what you were doing or what was happening around you. Once you know what sets off your symptoms, you can take steps to avoid these triggers or prepare for them. Knowing your triggers can help you breathe easier and live a healthier life. Asthma doesn't just affect your lungs, it can impact your entire life. Think about it. A regular day at the park, a sudden change in weather, or even a whiff of strong perfume can transform into a full-blown asthma attack. Asthma can place limitations on physical activities, making it a challenge to partake in sports or rigorous exercises. Even everyday activities like climbing stairs or walking a pet can feel like running a marathon. Then there's the impact on sleep. Imagine waking up in the middle of the night, gasping for air. Sleep disruption is a common occurrence for asthmatics, which can lead to fatigue, decreased productivity, and even cognitive impairments over time. But the implications of asthma go beyond the physical. There's an emotional toll to consider as well. The unpredictability of an asthma attack can induce anxiety, while the constant need for vigilance can lead to stress. In fact, studies have shown that asthma can increase the risk of developing mental health issues like depression and anxiety disorders. And let's not forget the potential for severe health complications. Without proper management, asthma can lead to life-threatening situations like a severe asthma attack, which can cause respiratory failure if not treated promptly. Other complications can include pneumonia, collapsed lung, or status asthmaticus, a severe and prolonged asthma attack that doesn't respond to initial treatment. But it's not all doom and gloom. Yes, asthma can be a significant part of your life, but it doesn't have to define it. There are countless individuals out there living full and active lives despite their asthma. The key lies in understanding your condition, identifying your triggers, and managing it effectively. In the next scene, we'll dive into effective asthma management strategies, so stick around. Because remember, you're not just managing asthma, you're taking control of your life. Asthma can be a big part of your life, but it doesn't have to define it. You've learned what asthma is, how it works, and its impact, but how can you manage it? Managing asthma effectively requires a combination of strategies. It's not a one-size-fits-all approach, but rather a personalized plan developed with your healthcare provider. This plan should include avoiding triggers, taking prescribed medications, and monitoring symptoms. Let's start with the most proactive strategy: avoiding triggers. Triggers are the catalysts that can cause an asthma flare-up. They vary from person to person and can range from allergens like dust mites and pet dander to environmental factors such as cold air or pollution. Identifying your triggers and taking steps to avoid them is an integral part of managing asthma. Next is medication. it's essential to use your prescribed medications as directed by your healthcare provider. There are two main types of asthma medications: long-term control medications that help reduce inflammation in the lungs, and quick relief or rescue medications that relieve asthma symptoms when they occur. Your healthcare provider will guide you on the right combination based on the severity and frequency of your symptoms. Monitoring symptoms is another crucial component of an effective asthma management plan. This involves keeping track of your symptoms and how often you use your rescue inhaler. Regular monitoring can help you recognize when your symptoms are getting worse and when you need to seek medical attention. It's also worth noting that physical activity is not off limits if you have asthma. In fact, regular exercise can improve your overall lung health. Just be sure to speak with your healthcare provider about what types and levels of physical activity are safe for you. Remember, asthma management is a continuous process. It involves routine checkups with your healthcare provider, staying up to date with your vaccinations, and maintaining a healthy lifestyle. It's about taking charge of your health, being aware of your body, and making informed decisions. With effective management, you can control your asthma and lead a healthy, active life. That's a lot to take in, isn't it? Let's quickly recap what we've learned today. We began our journey by introducing the topic of asthma, a chronic respiratory condition that affects millions worldwide. It's a condition characterized by inflammation of the airways, which can lead to symptoms like shortness of breath, wheezing, and chest tightness. Recognizing these signs is the first step to understanding that you or someone you know could be dealing with asthma. Next, we delved into the inner workings of asthma. We discussed how the airways become inflamed and narrowed, making it difficult for air to pass through. This inflammation can be triggered by various factors, from allergens to environmental elements. Each person's triggers are unique, and identifying what sets off your asthma is crucial to managing it effectively. We then explored the impact of asthma. It's not just about the physical symptoms. Asthma can affect your daily life, limiting activities and causing anxiety about potential attacks. But remember, it's not all doom and gloom. With the right strategies, you can navigate life with asthma and reduce its impact on your day-to-day activities. Speaking of strategies, we touched on some ways to manage asthma. This included monitoring symptoms, avoiding triggers, and using prescribed medications. It's important to remember that everyone's asthma is different, so what works for one person might not work for another. The key is to work closely with your healthcare provider to develop a management plan that suits your specific needs. And there you have it. We've laid the foundation for understanding asthma. Of course, this is just the tip of the iceberg. There's so much more to learn about this complex condition, and we're here to guide you every step of the way. Remember, understanding asthma is the first step towards managing it effectively. Stay tuned for our next episode, where we'll delve into natural remedies for asthma,